Good afternoon. My name is Marc Mason, RN, with the Confederated Tribes of Warm Springs in Oregon. And I'm here today sharing our success in vaccinating American Indians and Alaskan Natives against HPV-related cancers in the Warm Springs Indian Health Service area. I have no relevant financial relationships within the past 24 months due to the information I'm presenting today. So a little information about Warm Springs. It's a reservation in Oregon with a population of around 4,000 individuals and 6,000 actual enrolled members of the Warm Springs, Wasco, and Paiute tribes. The Warm Springs Reservation includes 640,000 acres in Oregon from Mount Hood to the Deschutes River, and is comprised of 3 districts: Senasho, Agency, and Siksika. Now, one of the great things about the clinic here in Warm Springs is it's the care home model. It's a one-stop shopping for most of your wellness needs. And that refers to a facility in which patients can have all of their basic healthcare needs met under one roof. At Warm Springs, we have primary care, lab, pharmacy, optometry, dental, radiology, WIC, women's, infants, and children, community health, a licensed clinical social worker, community health representatives, a diabetes program, a registered dietitian for the diabetes program, and a podiatrist, all in-house. We also have regularly scheduled clinics with specialists that travel to the Warm Springs Health and Wellness Center regularly to see our community. I should probably add a disclaimer that this information relates to non-pandemic strangeness, because things are operating a little differently than they normally would currently, of course. So I'll say straightforward, the information that I'm sharing today, my efforts in this knowledge are built on the extensive work by the Northwest Portland Area Indian Health Board and tribal health coalitions that did some focus groups in 2015 to determine areas that they needed to really look at, combined with constantly evaluating my own approach in interaction with patients and their parents. And I'm lucky enough to work in a position with a clinic that has worked hard over the years to build a close, trust-based relationship with the community we serve. And I'll say that is the first and foremost thing you need to have, and it does take work. So currently, the things that I work on and promote to increase our vaccination rates and HPV uptake are, I do bi-monthly VFC, vaccines for children, immunization audits and reconciliation, as well as due letters. And again, normal times. I'll print and send due letters for all of our pediatric patients every 60 or so days. This is more than just printing and sending the letters. For each patient, I'll pull up their chart, ensure they haven't gotten the shot since I did print that stack of letters, and pull them up in the state immunization database to make sure that they haven't been getting immunizations elsewhere. If they have, I update that information in our charting system because it doesn't talk to us, and then I will reprint the due letter if they're due for anything and send it out. The process might not be necessary for you if you have an electronic health record that the state database can talk to. Ours just does not. But we do send information out to it, so it will update for other clinics in the state. We also do schedule appointments for updating immunizations. I have my own schedule normally that I'll have patients come in and see me just for immunizations, and also try and get them scheduled to see providers to do well child visits, etc. But sometimes all they're interested in is getting their immunizations, and we will get what we can get. But we do accept walk-ins here in community health, and I also partner with the WIC department to update their patients, primarily pediatric, that come in for WIC visits and are due for immunizations. Normally, we're not going to see that patients that are WIC eligible that are due for HPV, but if they have other children that aren't actually on the WIC, sometimes they come in with the parents. So Also, I partner with the IHS Medical Clinic because we here in community health are separate. We're run by the tribal, a tribal department as opposed to federal. And when they have a high volume of patients on the medical end of the building, and they have patients that need immunizations, they'll call down to me and ask if I can take those patients and complete their immunizations after the provider's seen them. If I am not predisposed, I will say yes. They'll send them down, and I'll run it just like a normal immunization visit, and get them updated and get them going. Now, one of the things that's really neat that was done here in Warm Springs, in 2017, the Warm Springs Community Health Action Team, Chet, and the Warm Springs Prevention Team partnered with Oregon Health and Science University, and utilizing a grant, they were able to have posters made. These posters advocating and normalizing HPV vaccines as cancer prevention for adolescents were made utilizing local children. All of the children on these posters live here and are from Warm Springs in the photos. And it also incorporated local insignia of the Confederated tribes, the 3 teepees. And these were all put up in the local Warm Springs kindergarten through 8th grade academy, where kids would see it and it would get that idea more that it's a cancer than some kind of sex vaccine that a lot of people have that misinterpretation of. And that seemed to be a really successful program in taking some of that stigma out of the HPV vaccine. So some things that you might want to look at to focus on in your own HPV vaccine program, that we have looked at, are things like focusing on the successes of the vaccine. If you have access to information that can show what the rate of HPV-related cancers and precancers are in your area before the vaccine was made available, and since, if there's been any kind of improvements in your area or country, push that information. Let them, the parents and family know, like, hey, this has been successful. This is what we had before we had this vaccine. This is what it's looking like now. Normalize it. Talk about it like a cancer prevention vaccine, not a genital wart vaccine. Use direct terminology. Tell boys or men that it will prevent penis cancer. Tell girls and women that it can prevent cervical cancers, which, in addition to being potentially fatal, can also cause them not to be able to have children if that's something that they someday want. Involve your patients. I always start out my visits with asking the patients or the parent if they have any questions or concerns about the vaccine that we're discussing that day. And that puts them in the driving seat and focuses the visit on their care and not what we need to do to complete the visit, get the shots done, chart it, and move on to our next patient. It's very patient-focused care. And currently, Warm Springs starts patients at 11 with HPV 9, and at that age, children that age want to be treated as important as they are, and are right at that age where they need to be learning about advocating for and taking care of themselves. Their shots on their thoughts on a potentially life-saving treatment should be considered as important too. And so talk at the preteen or teen. Tell them all the things you would tell the parent, but direct it at that patient. Involve them, make them feel like they're actually important, because they are. If the parent is insistent on the child not needing the vaccine because they aren't having sex or are worried it will make them sexually active, use a bicycle helmet analogy. Do you put your bike helmet on before you get on the bike, or do you put it on right before you wreck your bike? You want to put it on before you get on. So even if the child isn't going to be having intercourse for decades, let's get them protected now so there's a non-issue. We all know sex isn't always planned and scheduled thing, especially among teens. Cultural awareness. Be aware in the community you serve of any concerns or history that may have taken place that might affect the view of the vaccine that you're offering. Specifically, so the Northwest Portland Area Indian Health Board found in interviews with parents and grandparents they were skeptical of the vaccine for many reasons, including not knowing enough about it, afraid of side effects, historical mistrust of the medical system, mistrust of the federal government, being that IHS is a federal facility, and also indigenous peoples have a terrible history of having their women forcefully sterilized. And there's fear that the vaccine was created to do that. So be aware of things like that if there's something going on in the community or the culture that you're serving. Be aware of missed opportunities. I'm not immune to this. I have had patients where I've gone back and done audits and seen that I missed an opportunity to offer a vaccine because they were there for something else and didn't think about it. If they're there for child checks, ER follow-ups, sports physicals, direct observed therapy for STIs, birth control, gyne visits, all of those are legitimate reasons to also offer those vaccines. And, looking to the future with HPV vaccines, especially in light of the COVID vaccines right now, and the initial success that they seem to be having, what are the possibilities with vaccines using the mRNA technology? I'm pretty excited to see where we go, not just for HPV, but other things. I've actually seen recently one of the CEOs of one of the current vaccines was talking about targeting cancer with this technology next, not just HPV. And that's an amazing thing that we can hopefully look forward to having advances in. And that's really what I've got today for you. If I hope you enjoyed this information and it helps you in serving the community that you serve and increasing your vaccination rates. Have a wonderful day.